The standard of care in hemophilia for decades have been factor replacement. So replacing the defective factor 8 or factor 9 protein with factor concentrate, first plasma derived, then recombinant, and nowadays in the, advanced molecules of extended half-life molecules. Yet, even with those newer molecules, there have always been limitations. Patients need to self-administer intravenously factor concentrates. In factor 8, that is 2 to 3 times a week. In factor 9, that used to be once or twice a week, so that's quite a high burden of therapy. But even with that high burden, patients are getting to almost zero bleeding phenotype, but they still experience bleeds. And I think the other thing is that over a full lifespan, also not too frequent bleeds will lead to cumulative joint damage. And in spite of starting prophylaxis at a very early age, I think most of my patients, older patients, still have a significant form of arthropathy. So there is room for improvement there.